Thank you. Sorry for that delay. And thanks also to ALNAP for letting me be a part of this today and to share our research this way. So I think you introduced the SAVE program pretty well, so I don't think I need to go through the background and structure of it, except maybe just to add that as a multi-year and multi-country study with a major field-based component, it was definitely the largest and most ambitious, and I think the most data-intensive study that we've done to date at Humanitarian Outcomes. And we were really pleased to partner with GPPI in taking it on. The goal of the study was to contribute to solutions for improving aid work in highly insecure settings. And as the initial phase of the research area that I was leading, what we were trying to do was, in a sense, to lay the empirical evidence base to measure and to show concretely how insecurity and violence in the operational environment affects humanitarian presence and coverage needs. So I'll be talking about the first component, presence and coverage, today. And these were the 4 countries that we were looking at, Afghanistan, Syria, South Sudan, and southern Somalia, which for the time period of the study, but also still largely today, had the highest levels of insecurity in the form of major attacks going on and aid worker casualties, and access constraints, which is why they were selected for the study. Now, some of you may be familiar with Humanitarian Outcomes work in quantifying insecurity for aid workers and the aid worker security database that we run and have run for the past several years. So measuring the insecurity in these places was, in fact, the easy part for us. The more difficult questions we were seeking to answer were, in these highly insecure environments, what is the level of humanitarian field presence in relation to people in need, which is a way of saying what is the humanitarian coverage? And then how is this humanitarian coverage level affected by changing security conditions, and can we measure that? And finally, are the types and sectors of programming affected by insecurity in these environments? And the biggest challenge, which is one I think that many humanitarian researchers are familiar with, is that the data that you need to answer these questions are just not readily available in any compiled form. And we know MSF famously asked the question, where is everyone? And when that report came out, I remember being struck by the fact that the answer is we really have no way of knowing at present, because detailed information on the humanitarian footprint country by country simply doesn't exist. So essentially, it's necessary to go out and gather these numbers and compile brand new data sets in order to answer these questions. And that's essentially what we did in the SAVE study. So we were looking to fill kind of major evidence gaps by gathering numbers first on humanitarian presence, which we defined as the number of organizations, personnel, and project activities per location in these countries. And by setting that against the number of people in need of humanitarian assistance in each area, we were able to calculate a proxy for humanitarian coverage. Now, I say proxy because ideally, humanitarian coverage would be measured by the percentage of people in need who are reached by and have had their needs met by humanitarian assistance. Now, to do that would be a whole other level of difficulty for the research, because one of the inconsistent ways that people in need are estimated across emergencies, and how the aid recipients in each place are divided up and cross-cut by sectors and overlapping agencies, and then the inevitable double counting that occurs. But so for our purposes, this was a useful proxy just to try to measure how insecurity affects the level and the configuration of aid operations. Right, so in terms of how we went about this, field work was really predominant in the data gathering. We had field-based researchers working with local research partners, doing the actual data gathering and verification in the field. So they would begin by compiling the existing data sets that existed, and here's where OCHA came in very, very helpful to us, and were providing us with the 3 Ws that existed in these places, and as well as other data sets and registries. So that was a really useful jumping off point. From then, they did systematic consultations of all the humanitarian actors in the context, both international and national, and essentially counted up the presence data. And they were assisted in this by confidentiality protocols that we developed in order to assure agencies that all this information would not be published against their specific agency's name, but would be anonymized and aggregated in any sort of public sharing of it. We also, of course, did some qualitative information gathering, and that was the practitioner interviews. So we interviewed all of these actors more in depth and really focused on the decision-making that they did regarding operational presence. So what were the determinants of their setting up operations? What were the conditions for expanding or contracting their presence and things like that? Really looking at where and how they operate. And then we did affected population surveys that were targeted to people living in these very hard to access locations. So mostly these were done via remote telecoms using interactive voice response technology. That's how we did it in Afghanistan, Somalia, and South Sudan. But in the case of Syria, it was deemed safer for the respondents and would encourage them to respond more if we actually did in-person surveys rather than do something over the phone. So we partnered with a local research institute called Proximity, who was able to go into 4 governorates and actually do household surveys for us. And what these surveys were asking people was the aid presence that they were seeing, the organizations that they saw in their areas, whether the presence was declining or increasing, and also the type and the quality of aid that they were receiving and whether it met their most urgent needs. So that was a way of sort of triangulating the other quantitative and qualitative data that we were gathering for the study. So as you can imagine, we faced some pretty significant challenges, many of which were expected, including the fact that aid organizations didn't always have complete and comprehensive records of their operational data, and often not at the level of granularity that we were asking for. And with some organizations, even if they were able to get us fantastic, totally comprehensive numbers for the current year, as we went back in time, the data would get spottier and softer. So we were asking for the current year and as many years back as they were able to provide. And for some organizations in some places, and this was especially true in Syria, we found a real deep reluctance to share the operational information, even with the confidentiality and anonymity assurances. Now, this was due to what we think are genuine security concerns, and what in Syria at the time was an atmosphere of sort of intense distrust. But we think as well there were some reputational concerns at play when the presence of agencies was not quite as extensive as they would have liked, and they weren't keen on that being shared necessarily. And finally, we faced the basic limitations of doing a part of our quantitative analysis, which was the statistical regression analysis on observational data. So listeners probably know that it's notoriously difficult for social science research taking place in complex real-world situations to meet the threshold for statistical significance and to make very strong claims in terms of attribution and causality. And so maybe it was naive of us to try, but I mean, I can tell you what we set out to show and what we were hoping we would find. We wanted to see for any particular area whether there was a strong inverse correlation, a statistically significant one, between rising insecurity and declining aid presence. And while the data that we collected did show overall patterns that suggested this pretty strongly, it did not meet the threshold for significance. And in the report, we go into the variety of confounding factors that explain why we think this is. However, even though those regressions were inconclusive, that, as I said, was only one aspect of our quantitative research, and the other parts of it did yield valid and, we think, interesting and useful findings. And those are the findings that I'm going to go through with you now, just briefly, hitting kind of the highlights. The first is the broad finding that only a surprisingly small number of organizations consistently work within the most dangerous locations in the most dangerous countries. And it's clearly not enough to meet the total needs in any given area. Now here you can see that out of all the emergency contexts that took place during the study period, those at the top of the list with the highest number of major attacks, shown in red on the right, have a relatively smaller number of organizations responding to the emergency per $100 million in funding, represented by the blue bars. And if you look on the bottom, the natural disaster type emergencies in more stable and secure countries on the bottom that have few or zero attacks have generally larger numbers of organizations responding. So maybe not too surprising that the more secure countries attract the larger numbers of agencies responding. But we were able to use the presence data that we gathered from agencies to dive deeper into who was present and who wasn't. And we were able to calculate a ranked index of the most present organizations. So the ones that in these countries, in the highly insecure countries, were operating in the most dangerous areas as measured by acts of violence that took place there. Now, we were working with an applied mathematician to do this, my co-author, Shoaib Jilani, so shout out to him, and also a few statisticians. So what you're seeing now is in its kind of anonymized form, but you can see that it's only about 7 INGOs, a Red Cross movement entity, 3 UN agencies, and several national NGOs, which in every context we found would be at the forefront of operations in the most insecure places, and who, of course, are critical to the overall response. A second, a more qualitative finding, but one which was supported by the data and the affected population surveys, was that security, or the lack of it, represents for agencies the most important determinant of where they are present. So more than the level of need, more than the availability of funding, their decisions are mainly determined, driven by the state of security for their staff. So what happens is that this results in unequal or skewed coverage, where you see larger numbers of agencies clustering in more safe areas, leaving coverage gaps in other areas where the needs may be far higher. And that donor policies, including counter-terror legislation and financial regulations, will contribute to this and exacerbate the skewing effect by making agencies even more reluctant to work in these high-risk areas. And just to quickly use Afghanistan as one example, you can see here that the insecurity is represented by the darker shades of red, and the level of humanitarian coverage that we calculated shown by the blue circles. So I think you can see on its face that coverage is generally higher in the less insecure northern provinces, and lowest of all in the Taliban strongholds of Helmand and Kandahar, which have seen more violence and displacement, and where very few agencies are working, even still. And the reason why subnational data that we collected is so important here is because the skewed and declining coverage is something that you really can't see at an overall country level. So it's rare nowadays that an organization will pull out of the country completely, even if it's been attacked. So you get roughly the same number of organizations in the country year after year. But what you don't see is that they may have contracted their presence, pulling back often to provincial capitals or the national capital, and shrinking their presence and activities in the field, the number of staff in the field. So what you see here is the declining average number of districts that agencies cover in Afghanistan over the period of the study. So this has been a trend that has really been obscured by lack of detailed data. The data that we collected and the survey findings also showed pretty clearly that in the insecure, hard-to-access locations, programming in general becomes more basic and rudimentary, and really less able to be targeted to specific vulnerable groups. And this stands to reason. Organizations that cannot move their staff freely within a country will have trouble getting the skill sets they need out in the field, and that limits the technical complexity of what they can do. And especially when their staff and programming is highly localized, meaning everything is done using staff hired from the immediate vicinity, or when they're working remotely through local partners, it becomes still more difficult to identify and target the most vulnerable, and may not be culturally accepted to do that. So instead, the focus will shift to reaching more people with simpler sort of deliveries. And then we also found, as kind of a side note, that as kind of food deliveries and deliveries of NFIs tend to go up in insecure emergencies, and the more complex health type of programming goes down, at the same time we also don't see protection activities rise as you might expect it would, given the increased protection needs. It goes up a little, but not to the level you would think, given that these are protection crises, many of these situations that we're studying. So this is also a function of lack of access, making more complex programming difficult for agencies. Now finally, and this is kind of the take-home message of the study, is the fact that it's been so hard to get a clear picture of humanitarian presence and coverage in these places that what happens is coverage can appear to be larger, more robust than it actually is. So both agencies and donors have incentives to exaggerate the reach of their humanitarian efforts. And we make the point that humanitarian actors really undermine their own advocacy in this regard. By wanting to appear to their donors and to the general public that they are present and they are working where the needs are greatest and they're able to respond, inadvertently here they're making the humanitarian situation maybe seem less dire, and by extension taking the pressure off political actors to find solutions to the conflicts. I'm going to stop there as my time is up, but I look forward to taking questions and also to hearing Sandeep's presentation.
Great. Thank you so much, Abby. Really, really interesting. I'm sure we could talk about this for ages. Fascinating to see how you've taken a topic that lots of people talk about but don't really have a concrete or tangible feel for and put some numbers on that, and it ends up revealing some very troubling trends, which I'm sure Sandeep is going to build on. Just before we get to Sandeep, a quick follow-up question for you on method. You just mentioned in your presentation that with the SAVE research, you tried to use statistical analysis or you did use statistical analysis to try and measure the impact of violent incidents on the level of humanitarian coverage at the subnational level, and ended up with no statistically significant findings on this. And so you turned to other components of the research to kind of build in that picture of the causal relationship between insecurity and the decline of presence. I was wondering, stepping back from this and looking at statistical analysis as a method, do you think as a researcher that these kinds of harder quantitative approaches to humanitarian questions are still valuable, even though they can't get us to kind of clear and direct answers on a lot of these questions? And also, how do you think we can become a bit more rigorous at understanding causal relationships without quantitative approaches, for example, using some of the qualitative approaches that you were using in this research?
Yeah. So absolutely. I think that most of us in the humanitarian sector would agree that, in general, the field is quite data starved, and the research has traditionally been, I would say, very qualitative and soft. So there are two types of statistical analysis, right? There are descriptive statistics, which can tell a compelling story, and then there's the inferential statistics, like regressions, where you're trying to prove causality, at a level of significance. You can have one without the other. In many of these cases. And as I mentioned, the first challenge is to go out and gather the data ourselves to build these data sets to analyze. Even doing this alone, bringing the data in is, I think, a worthwhile contribution. Having the concrete numbers is useful and important. Even if they're not conducive to regression analysis, they can still tell us some interesting things. But having said that, I do think it's important and worthwhile to continuing to experiment and to test the data for significance using various questions and variables, even if most of the time you're not getting the p-values that you hope for. And as an extension of that, as good practice and to kind of move the field forward and to avoid falling into the trap of publication bias, it's also important to publish the findings even when they're inconclusive, and to discuss the confounding factors, which we tried to do. You also asked about qualitative approaches and how to make them a bit more rigorous. I think you can do that. Interviewing is kind of our stock and trade in this field. That can be made, I think, more rigorous and systematic through more thoughtful and representative targeting of interviewees and more structured analysis of it. So you're not inadvertently putting more weight on, the most recent interviewee, for example, and really being aware of cognitive biases when you go through the information that you've gathered. And finally, for a few years now, we've been calling for increased surveying of the affected populations, which is possible now through this technology, and really allows you to reach people in remote and hard to access locations. And I think that's important because it gets us away from the more tokenistic small focus groups and situation you see sometimes where an agency will only survey their own beneficiaries.
Great, thanks so much, Abby. Really interesting perspectives there on how to combine these two approaches and their distinct values, and on the surveying point as well, how much easier it's become to get some of this this richer data.